Dr. Ryan will be joining the show shortly. Expect his call momentarily. In the meantime, I'd like to remind everyone that Clear Creek County will be launching a COVID-19 community impact survey to better understand the needs of our community. Actually, that was initiated yesterday, the 15th, the Ides of March, beware. Every household in the county will be mailed a paper copy of the survey, so keep your eyes peeled for this envelope. Please take a few minutes to respond. I think it's about 15 simple questions. Excuse me. KYGT. Yes, hi, doctor. Hang on just a second, please. All right, everyone. We've got Dr. Ryan on the phone, and as I was saying, just keep your eyes open and watch your mailboxes for that survey. It's very important data that the county is collecting so they can do the best to help us move forward through the pandemic and to the world beyond. Good morning, Dr. Ryan.
Good morning, Mike. How are you?
Well, I'm doing good, and geez, you're so generous with your time to join us. It's been every week for the last few weeks, and we deeply appreciate it. Let's get right down to it. I wanted to start out by, first of all, I guess we should talk about Clear Creek County and the state of Colorado. Why don't you give us an update on the cases, please?
So here in the state of Colorado, the numbers, as I stated earlier, have plateaued, meaning they're no longer in the decline, which is a problem. You want to continue to see that decline, but they've actually plateaued. And so we're obviously really keeping an eye on that. Our numbers in the county have also plateaued, I guess, is a way to look at it. We've had 7 cases this week and 7 cases last week. Our 2-week incidence has actually gone up, now above 144. Which is a problem. And as we learned today, we now have a case of one of the variants in Clear Creek County as one of our cases. So I just learned of this, and so we'll be actively tracking that throughout the day. But it's all the more reason why we need to keep doing what we're doing and wear a mask and socially distance and get vaccinated as soon as you are eligible.
Yes, I just wanted to say that even though I'm vaccinated, now that I know that there's a variant here in the county, I'll be doubly diligent to keep my mask on and stay at least 6 feet distance when I'm inside from anyone. I looked at our state data, and you talked about the plateau, and it looks like we haven't really budged in about a month. We've stayed right in that 1,000 per day, 1,000 cases per day in the state of Colorado, and somehow we think we're doing well. I guess, I don't know, but I also heard Dr. Fauci express concern regarding the state of the virus in Europe, and he has said that we have seen in the past that an upward trend in Europe foreshadows one here in the United States. I know that's not a one-to-one prediction, but it certainly is concerning to hear him say that.
Oh, absolutely. And he has better insight than most in terms of data and availability of that. And so typically we follow suit with what Europe does in terms of our numbers, which we've seen over the last year. So to see an increase in the case counts there is troubling, particularly now that the UK variant is here in not only in Colorado but all across the country and is predicted to be the #1 variant in the country in the coming months.
All right. Well, we'll keep our eyes focused on that and keep wearing our masks and social distancing no matter what our vaccine status might be. We're so close to the finish line here. If we just do the right thing for the next couple of months, I recall my dad always telling me over and over, he repeated the story of one of his friends from the neighborhood who was in the Army and deployed in somewhere in Europe and was killed 12 hours after the armistice was declared. And I just think of people who are alive today who are maybe vaccine hesitant or not complying with mask recommendations and are going to become severely ill or even possibly die when the end is just right around the corner. It's just so tragic at this point to succumb to your venal desires when it's just so simple to wear a mask and become vaccinated.
Yeah, Mark, I couldn't agree more. Continuing to do what we've been doing for the last year, just for a few more months until we can get enough folks vaccinated and reach that community immunity point is really critical, particularly now, to your point. We have a vaccine. We have many vaccines. We have the solution to our problem, and it's just going to take patience to get there.
All right. I wanted to talk a little bit about vaccine hesitancy. That's going to be an issue here as much as we have watched with frustration the rollout of the vaccines, which is now it seems I've seen numbers over 3 million doses a day on some days, and we're averaging 2.5 million a day, and they say many more to come in the near future. It seems to me that within a short period of time, we're going to be down to the people who are hesitant for vaccines. I wanted to talk a little bit in that context about the AstraZeneca vaccine. It's been suspended for use in about 20 countries, primarily in Europe, and most recently, just yesterday, France, Italy, and Germany. Norway and others have also suspended its use, and it's because of some discovered blood clots that they fear may be associated with the vaccine, although there is to date no direct proof that is true. What's your thoughts on the vaccine hesitancy in regards to the AstraZeneca and any of the available vaccines here in this country?
Mark, I think you raise a good point. So vaccine hesitancy is a real thing. People are hesitant for a whole host of reasons. So I think it's incumbent upon public health and others to get the facts out there to try to dispel as many of those perceived notions as we can from people who are hesitant. As far as the AstraZeneca is concerned, from my understanding of the data, there's been 30 cases among 40 million people who have been vaccinated with AstraZeneca. So for numbers like that, with no actual proof that the vaccine is the one that caused or was a cause of the blood clotting, 30 cases out of 40 million people, to me, just on the surface of it, doesn't suggest a causal relationship between those two. So I know they're looking into it further in terms of what potential that vaccine could have caused those blood clots. And in all 30 of those, only one fatality. So one fatality out of 40 million people, it doesn't necessarily suggest that there's a causal relationship between those two, the vaccine and the blood clot. So we'll have to wait until further evidence comes out one way or the other. Whether France and Germany and Italy made the right decision by stopping the use of the AstraZeneca, I don't know based on the limited data I have seen and understand. I don't know that was the right decision. When you have such low numbers of 30 out of 40 million or 1 out of 40 million, does that necessitate the halting of vaccinations, particularly given the fatality rate of those with COVID? So it's really a numbers game at that point, and was that the right decision? But as far as hesitancy in our state, in this country, and in our county, if there are folks out there who need more information, please let us know. We're more than happy to talk to you, more than happy to share that information. If you do get information about vaccines, make sure you go to a reputable site. So absolutely no news organization whether you perceive it to be news or not. I would go to places like the World Health Organization and the Centers for Disease Control, the CDC website, NIH website. Those are really the only ones that I would trust with any sort of information. Anything that is someone's opinion, I would ignore it. It's probably not fact-based. It's probably fear-based information, good or bad. So I would avoid those sorts of sources of information and stick to the ones that are science-based.
You talk about science, Doc, and I think one of the frustrations people have is a misinterpretation of what scientific data actually is. People want absolute answers, and science is only the knowledge that we have at this moment in time. That's really all it is. Whether it was Newton and his apple, or it was Einstein and his elevator, there's always a progression of science, and we learn things that we didn't know, and what we thought was absolutely true becomes not so much so. But so we can only rely on what we know, and the search for absolutes is it's a tilting at windmills as far as I'm concerned. I just wanted to throw out the statistics. I looked them up for Germany this morning. Out of 1.6 million people who have received the AstraZeneca vaccine in Germany, 7 people have developed cerebral venous thrombosis. Those are those blood clots that everybody's so concerned about. None of them have died, but they have been averaging over 14 days 212 deaths from COVID. No deaths from the vaccine, 212 a day from the COVID. I mean, if you're looking for an absolute, that's as close as you're going to get.
Right, and that feeds right into what I just stated about Germany and Italy and France's decision to halt the vaccination. The number of fatalities due to COVID is far higher than even the current data suggests it would be with the vaccine. So don't know if it was the best decision in the world, but I'm not the Prime Minister or the Health Minister of Germany, Italy, or France. So I do with what I can. And in Clear Creek County, we're going to continue to disseminate the vaccine as we receive it, both the Moderna and hopefully shortly we'll be receiving more of the Johnson & Johnson vaccine and get that out to any and all folks who want it. I would ask those folks who have been vaccinated not only to continue to wear your mask, obviously, but to reach out to family, friends, neighbors, and share with them your experience in getting vaccinated. I think that will go a really long way in helping those folks who are hesitant for whatever reason, whether it just be fear of the vaccine or fear of a shot or whatever. It might go a long way to help hear from friends and neighbors and relatives that, nothing went wrong. It was actually an excellent process, and it was quick and painless, and that sort of information goes a really long way for people.
Well, Doc, let's share our experiences. If right now, I'll start. After my first injection, I had the slightest of soreness at the injection site and no global symptoms whatsoever. After my second injection, I woke up the next morning with a headache, and I had some body aches. Let's say on a scale of 0 to 10, I would categorize them as about 4. They subsided later in the day. I was still able to complete a 4.5-mile hike that day, although it was not pleasant to do. But I did do it, and that was the extent of my experience. How about yourself?
I appreciate the confessional. So after my first dose, I had no symptoms whatsoever. My arm was a little sore the next day, the injected arm, but otherwise no problem at all. The second dose of the Moderna, similar to you, the next day I did feel some fatigue and chills and just felt some general malaise. I just didn't feel well. I took 2 Tylenol, and by the end of the day, I felt much better. And the next day, I felt just fine, no problem at all. So Similarly, most of my staff that received the vaccine, the Moderna vaccine, had similar situation. The second dose was really the one that they felt some sort of side effect from, but those side effects generally went away within a day or two at the very most.
Well, I'm glad that you and your staff have had the similar modest reaction to the second dose with nothing from the first dose. I wonder, with the amount of vaccine that you've distributed here in the county, have you had any more severe reactions that you are aware of?
We have not, actually. One thing we did learn on our Johnson & Johnson vaccine weekend was you need to come to get your vaccine hydrated. Having a heavy night of drinking followed by half a gallon of coffee does not make for a good outcome. So we did have a handful of people pass out from the vaccine, but I don't think it was from the vaccine. It was from them being severely dehydrated and then getting a shot. So, but otherwise, no, I haven't heard, and a lot of people have responded back to us and shared feedback with us around their experience, and they've all been relatively benign. No significant side effects at all.
Most of us had our first individual experience with a COVID isolation, let's say, or a reaction to the COVID about a year ago. Many people are celebrating an anniversary this past week of isolation and mask wearing and all the rest. I wonder, when you look back over the year of a response to the COVID pandemic, what are your thoughts? What sort of things you might have done differently, or positive feelings you might have of the reactions that you took?
You know, my early efforts in COVID were in Larimer County, where I worked on their outbreak investigation team, trying to keep COVID out of the homeless shelters and the jails in Larimer County. And I felt a great sense of pride and a great sense of responsibility doing that, and we were quite successful in doing that. But shifting to my current position in Clear Creek County, a much bigger set of responsibilities now, much more broad than just homeless shelter and the jails, to a much broader community. So to me, I'm an epidemiologist. I've trained for this very moment, right? The study of epidemics and management of epidemics, and here we are in the middle of one. So I thought I was as well prepared as anybody could be as far as this goes. But the time, spent inside and the time spent constantly with my family, I love my family dearly, and I'm pretty confident they're not listening right now, but it's oftentimes overwhelming when you couldn't go outside and you couldn't interact with other people. So I think it's really important for people to find other things. Just go outside for a walk or read a book or do something else to take your mind away and take your mind somewhere else. Read a tourism book about Italy or wherever, someplace that you want to go in the future. Because we will get there one day in the not-too-distant future. We just need to continue to do what we're doing, get vaccinated as quickly as we can, and then hopefully we can move on from this. But more importantly, learning from this and learning a number of very valuable lessons, I think is going to be very critical. What they call the postmortem of any situation, I think is going to be the most valuable as a society moving forward. It's going to tell us a lot about who we are.
I just hope that the main thing we've learned as a society is to react efficiently and expeditiously when a crisis occurs, whether it's the next pandemic or whatever the crisis might be. No foot dragging, no politics. Let's just get after the problem at hand. I hope that's the lesson we can take away from our experience over the last year.
Yeah, Mark, I couldn't agree more. I think, there's experts in most subjects. And when something like this hits, myself as an educated individual, I look to what I know to be the experts, none of which are politicians. They're the virologists, the immunologists, the toxicologists, and epidemiologists, and so on and so on and so on. And those are the folks that I go to first to understand what's going on and how to manage it. And unfortunately, in this country, politics, we had the wrong flavor of politics over the last several years. And that really muddied the waters and made things seem to be very different than they actually were on the ground.
All right, I want to shift gears here for just a few minutes, and then I'll let you go. I know you're going to be busy tracking down that COVID variant, but I wanted to talk about the vaccination and mandatory vaccinations. I heard you say in your COVID update to the county commissioners that someone within one of the emergency response units had refused the vaccination, now has been exposed, or at least, and maybe has contracted COVID-19 and has implications for the rest of the staff. I would say that my experience personally, and many thousands and millions across the country who have worked in the healthcare profession have had similar experience, that if you work in an environment where you are exposed to diseases, you need to be vaccinated. And 13 years I worked in an emergency department, and every single year I was vaccinated for the flu. And if you didn't want to be vaccinated, then you wore a mask all day, every day, no matter what. That was the only option that you had. And so I think that people, we should think in terms of certain industries, certain businesses should consider mandatory vaccination of their employees. Your thoughts?
Yeah, I agree. I think there's certain professions where folks need to be vaccinated. I don't think that they can go without, particularly when they're constantly exposed and at risk, and put other folks around them at risk, particularly their coworkers. So as far as the mandate, though, it's up to really that department, whether it's the fire department or EMS or law enforcement or hospitals. That's really the decision that's made there. I agree with that decision, though, in those scenarios where they're putting everyone else at risk, who then subsequently put everyone else at risk, right? If doctors and nurses aren't getting vaccinated and they're taken out, then there's nobody to replace them for the need when it arises from the general population in terms of the need to use the hospital. So in that scenario, I think it's absolutely critical. Whether restaurants and those sorts of things, that's really up to the individual business and whether they want to mandate that or not. I imagine they'll get some pushback, but I imagine they'll also get some folks who wouldn't have been vaccinated who are now going to get vaccinated because it's mandatory. So.
Yeah, I can see that there might be a line between those two different types of employment. Certainly, if there was an outbreak among the members of the fire department, for instance, I don't know who you think's going to put out your house fire if the entire fire department is down with COVID. So in those types of jobs where there just isn't a backup force available, I think think that mandatory vaccination is something that should be considered. As far as a restaurant goes, my wife and I owned one for 33 years. If we were still in the business, I would absolutely say to all of the employees, as soon as you're eligible, you're going to be vaccinated, because we're not going to jeopardize our business for your, whatever reason you don't want to be vaccinated. We're just not going to do it. So that's my thoughts on that one. I wanted to end with one last thing, a piece of information. I heard you say that there might be a change in the eligibility for vaccination coming by the end of the week. Can you expound on that?
Yeah, it's my understanding, and obviously we have to wait for the governor to make the declaration, but that he is going to lower eligibility down to 50 plus from its current state at 60 plus. So probably in the next week or two at the most, folks who are 50 years of age and older will now be eligible to get the vaccine. But again, we need to wait for the governor to make that declaration to be able to put it into place.
So, Doc, in anticipation of that change, folks who are 50 and over here in Clear Creek County, 50 to 60, I guess, that group that has not been eligible, they should probably go on the website and get themselves registered. Am I correct?
Yes. Yep. So on the Clear Creek County Public Health website, the COVID tab, click on that, and then there's a bunch of information. Just follow along. And then click on the scheduling. And if there are currently no clinics or vaccines available, you basically register yourself to be included in a future clinic. And so hopefully we'll be having one at a minimum or two a week in the coming weeks. So we'll get you vaccinated.
Okay, so one last thing. I heard you say 340, I believe, vaccines that will be distributed tomorrow, and we hear all kinds of talk about greatly expanded vaccine availability. What are your thoughts about what's coming our way?
Well, as you know, we were previously getting 100 every other week. We have now done north of 2,500 in the last 2.5, 3 weeks. So a significant uptick in the number of vaccines we received. This week, not as many as we wanted. We asked for far more than we received. But we're going to continue to ask for a significant number and hope that one day we get them. So I imagine here in the next several weeks, we will now be receiving what we asked for. Anywhere from a minimum of 500 to more, depending on, obviously, the availability. But my understanding is that availability is going to increase in the coming weeks. As I said last week, over the next 4 to 5 weeks, so now it would be the next 3 to 4 weeks, we're going to be seeing a significant increase in the number of vaccines we have to disseminate to the broader community.
Well, that's certainly great news. So everyone get on that clearcreekcounty.us website, and you'll see the COVID-19 tab. And just follow the links, and you'll be able to register. I went on that, by the way, and it's just the easiest thing to do, to become registered and get on that list for vaccination. And I can tell you from my personal experience, everyone, that once you're fully vaccinated, it feels great. And you're doing a service to your community, because until we have that herd immunity statewide, countrywide, and worldwide, we're not out of the woods on this thing. So get on down there, get yourself registered, and get on down and get your vaccination. Doc, any last words?
No, Mark, I appreciate your time, and I just ask for everyone's patience. We will vaccinate you, as I've said, every week, as soon as we possibly can. Please reach out to friends, neighbors, relatives. If you do know anyone who is 60 plus who has not been vaccinated and is having trouble, please let us know. We will reach out to them either by phone or direct in person to try to get them vaccinated as quick as we can.
Okay, Doc, thanks a million once again. We so appreciate you coming on and sharing your valuable information with us. We'll talk to you again soon.
Sounds good. Thank you, Mark.
All right, everyone. Dr. Timothy Ryan. What a tremendous asset he's been, and his whole staff and all the emergency responders here in the community, the county government. We've had such a tremendous response here in the community. I just am so grateful to live in an enlightened community such as Clear Creek County. This is as we all knew for already, it's a great place to live. I want to leave you with this public service announcement that has come from Clear Creek County. As of March 15th, Clear Creek County is launching a COVID-19 community impact survey to better understand the needs of our community. Every household in the county will be mailed a paper copy of the survey, so keep your eyes peeled for this message. Please take a few minutes to respond. By taking the survey, you will help find new solutions to community problems and give the county valuable information needed to take action and support those most impacted by the COVID-19 pandemic. Even if you haven't been sick, your answers will help. That's definitely true. The survey is also available online if you want to participate in that way. It's at clearcreeksurvey.org. Thank you very much, everyone, and we'll be back with you again next week. Here's some pre-recorded